is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. Welcome to our channel. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice integrative medicine and gynecology. We're so happy to be back. Hope you all have had a great weekend. Today's topic is going to be about male hormones. I'll be talking about only two male hormones. They are testosterone and estrogen. If you've never subscribed to our channel, go ahead and do so. We upload 2 videos a week all about integrative health topics. Go ahead and hit that little notification bell at the bottom so you know when we've uploaded our next video. And always, we appreciate when you give our video a thumbs up.
So welcome to our channel today. In the past, we did a video on testosterone specifically, and I wanted to do a video just kind of a guy's guide to hormones, and it's kind of more of just a real life and approach to how men should view their hormones as we age. So just as an introduction, by the time we get 40 years old, most men start to experience some symptoms of low testosterone, and typically it's in the form of mood changes, depression, fatigue. It's not always erectile dysfunction. Well, certainly that's sometimes it can be the first sign, but oftentimes it's not. And it's not always a good thing to just immediately jump to replacing testosterone, because we really need to look at the entire person and look at their lifestyle as well. It's not just give somebody, throw testosterone at them. Yeah. As men age, we oftentimes don't get testosterone measured, and when it is measured, oftentimes the reference ranges are based on age-adjusted references, assuming that they're going to decrease anyway. So even if you do have a low level, the reference range that the doctor is going to be using is actually low as well, and you may not have the diagnosis of low testosterone. So oftentimes it's missed, and it's kind of like a slow process erosion of testosterone concentration in our bloodstream. Be aware of that. Be very cognizant of the fact that if you start feeling some unusual symptoms, then you really should have it checked. Another thing to consider too is when you do have low testosterone, you need to oftentimes ask the question why. And one of the things that we don't normally look at is environmental exposures. There's one particular chemical called BPA, which actually can cause a decrease in testosterone. So if you have an exposure to BPA or heavy metals, BPA is oftentimes in plastics, you're in agriculture and you start noticing a decrease in testosterone, you really should have some of these toxic substances measured by your physician. So make sure to bring that up when they're talking to you about this, or if you're a mechanic or you work in some type of welding type environment. So the next question I often get asked is, really should I be worried about it? Well, if it decreases with age, should I be worried? Well, you should. If it goes down too much, it can affect the vitality of the entire individual. So it can affect your musculoskeletal system, affect bone density, muscle mass, and strength. It can also affect cardiac health, and you put yourself at risk for heart attacks if you really have a low testosterone. A neuroprotective effect of testosterone in the brain, so that if you start to experience brain fog or you have a family history of Alzheimer's, you really need to make sure your testosterone is checked and it's actually maintained at a very good level in order to protect yourself from progression of any kind of neurodegenerative disease. DHEA, which is a precursor to testosterone, has shown that if it's low in the bloodstream, it also can lead to increase in all-cause mortality. So you really need to be very aware of a lot of these metabolites that are in the system that come down from cholesterol. So if you're taking a statin, which really lowers your cholesterol down, then you really should be aware of the fact that you're actually at risk for having a low testosterone. The other thing that's interesting too, some of the associations with low testosterone include what is called a metabolic syndrome, which is diabetes, hypertension, and increased cholesterol. And so make sure that if you have any of those symptoms or you've been diagnosed with metabolic syndrome, you are at risk for decreased testosterone. One of the other things that are asked is, how do I know if I have low testosterone? Well, there are some tests, questionnaires that can be done. It's called ADAM, A-D-A-M, and it's an easy test to administer. And if you score a certain amount, then you may be at risk for having low testosterone. There's other tests that can be done, such as a blood test, And if you look at the literature, there's all kinds of debate about, is there an absolute value that if you go below it, you actually have low testosterone? Well, the best advice I've seen so far is that you have to combine low testosterone level with other symptoms as well to actually really be considered as having low testosterone. And right now, for the best I could see, is that 300 seems to be the line in the sand where people draw and they say, okay, if the total testosterone is below 300, then yeah, you probably have you have low T. Now, the other thing that be measured too is something called free T. In the bloodstream, we have a component of testosterone which is called free testosterone, which actually is the active compound in our system that actually does all the great effects we need for testosterone. If your free T is below 50 picograms per deciliter, then that is considered low, and that really should be addressed. So it's not just measuring the total testosterone, you should also look at the free testosterone, because you could have a normal testosterone level and have a free testosterone level that's below 50, and you're at risk for having the effects of having low testosterone. So next question is, what can you do? Let's say you've been diagnosed with low testosterone. Do you immediately jump to having replacement? The answer is no. Really, any physician who starts to prescribe testosterone really should be asking questions about your exercise, what nutrients you use, what is your sleep like. All these things do make an impact on your testosterone level. In fact, a lot of studies show that rigorous exercise can increase your testosterone levels. And rigorous exercise, not just aerobic, it has to be weight resistance training as well. It doesn't have to be powerlifting, but weight resistant training itself can actually increase your testosterone levels. So you really need to be aware of that. Also, too, there have been associations with people with obstructive sleep apnea and low testosterone. Some nutrient deficiencies are important to maintain your proper testosterone level. They include folate, zinc, magnesium, some of the vitamins, vitamin C, vitamin B6, vitamin D especially. I want to put emphasis on vitamin D again because, as we've talked about in some other videos, vitamin D is not just a vitamin, it actually functions as a hormone, so it's very important that we maintain it at a normal level. And for us, we typically think of it as around 50 to 60. And it's really above what a lot of the reference labs are using right now. Okay, so let's say that your doctor did prescribe hormone replacement therapy in the form of either a topical testosterone or injectable or a pellet. Is that good? Well, yeah, it is. But you should be aware that it should be kind of a process where you get nudged into getting your testosterone level at a normal level and not pushed into a high, higher than what normal than what you need. It should be really based on the individual patient.
Being the people that you are, know the newest update is that oral testosterone is not safe. So everything that Dr. Lucio just said is all topical or injections, but not oral, which means taking it by pill. Never take testosterone tablets.
And there are some side effects that occur with taking too much testosterone. They include acne, alopecia, that's hair loss. You can increase your risk of certain liver tumors. It can decrease that HDL, the LDL ratio that's in your bloodstream. So as you remember, when you're looking at cholesterol, you want the HDL level to be higher than the LDL level, which is the bad cholesterol. Too much testosterone actually reverses that effect, so it puts you at risk. It can also result in insomnia and water weight gain. I'm going to include on a list some other side effects that can occur with taking too much testosterone. So really, when you're started on it, make sure your physician has a program in which they will recheck it again to make sure you're on the proper dosage. Okay, well, let's talk about estrogen. Not many people talk about estrogen with guys because we usually talk about testosterone. As you know, everybody thinks that estrogen is a woman's hormone. Well, we make it as well. And as we get older, if we get a lot of that abdominal fat, like that beer belly fat, there is an enzyme in that fat that turns your testosterone to estrogen. It's called aromatase. And what happens with that? We develop man boobs. Okay, it's not very appealing. Nobody wants that. Other things can happen as well. It increases as your estrogen goes up. You increase risk of heart disease. brain fog, loss of muscle mass. So what do you do about that? And I've had some of my patients come in and have had high estrogen levels, and everyone's like, well, what do I do about it? Well, what you want to do is decrease that aromatase activity, that enzyme that converts testosterone over to estrogen. And there are a lot of good nutrients that do it, as well as exercise, like I mentioned with the testosterone replacement. You want to make sure you have a healthy lifestyle. Some of the nutrients that are specifically considered aromatase inhibitors, they include flaxseed, resveratrol, which is in red wine, a stinging nettle root, not the leaf of the stinging nettle, it's the stinging nettle root. It's very important. And there's some others. We're going to include that as a list of things that you can incorporate into your diet that also help decrease that conversion over to estrogen. Now, also too, if your spouse has estrogen, topical estrogen that they're using, and they apply it to themselves and they go to bed with it, you got to make sure you're not contaminating yourself if you contact your spouse who has that estrogen.
You remember how long that transference can take effect. So if a woman's using estrogen cream or if a man's using testosterone cream, do you remember how many hours that risk is? It's 6 hours. So try to avoid your grandkids from hugging your thighs if you're putting the cream on your thighs, or if you and your spouse are sharing the same toilet, that toilet seat still has cream on it right after they've just sat on it. So just be really mindful of that.
Just remember, as men age, there's 3 important things decrease: our testosterone level, our progesterone level, and our DHEA level, which is a precursor to testosterone. Some things increase. Estrogen increases. Sex hormone binding globulin, SHBG, increases. Now that's important because that is like the chaperone for testosterone around our system. If that's too high, that binds the testosterone and doesn't allow it to do its job. It's not free to do the job, as I mentioned. We really need to know what the free testosterone level is. So I just want to close with just making sure everybody understands that, low testosterone is important, and it's okay to supplement, but make sure that the doctor is asking you questions about your exercise routine, your diet, what type of nutrition you're having, stress levels. All these things can decrease testosterone, even your sleep pattern. When we are under a lot of stress, we start producing more cortisol, and then that's referred to as cortisol steal phenomenon. And so there's less available metabolic components to make our sex hormones, and this is what happens when we're under a lot of stress.
Doesn't it always seem like we go back to the whole person? Mm-hmm. Because just like you said, you can only make stress hormone or the sex hormones, but you can't do both at the same time. We're back to that same metabolic pathway where every hormone starts from a base of cholesterol, and then it drives down to cortisol, which is our stress hormone, or our sex hormones, testosterone, estrogen, progesterone, DHEA. So if men are under a lot of stress, they're going to be shunting more of that into making cortisol and less into making their sex hormones. You have to address the whole person.
To just simply throw testosterone replacement at a man because their testosterone is low is really doing, in my opinion, a disservice, because there's other things that can also help bring the testosterone up without having to use large amounts of testosterone replacement. And please understand too that once this gets started, you really need to have this monitored after you initially start, but probably about 3 months later, just to measure it. And as I mentioned, blood tests are very convenient to be used. Now there's also saliva testing, which Jennifer is very familiar with, and she uses a lot with her patients. With testosterone, you can use blood as long as you understand what you're looking at, which compartment of the body, the testosterone that you're measuring.
Today's topic perfectly leads into what we're dealing with next Sunday, which is chelation. Chelation is where you can get rid of your heavy metals. It's controversial in conventional medicine, but we're using safe protocols. So why don't you say a midweek check-in?
Okay. Our midweek check-in will be on forgiveness. It's a very appropriate topic, especially during the holidays. Thank you for joining us. Bye-bye.